Now we'll talk about some very key important aspects of trying to examine children. All right, trying to hit on things that you shouldn't miss. Okay, when I examine a child, things that you shouldn't actually miss out. So physical examination of infants and children. Okay, so if I'm actually trying to, you brought the child to the hospital, so I actually take my medical history. Next is the physical examination, right? So what are the things that I shouldn't miss out as a medical professional? So physical examination is the patient has complained, and you as a medical doctor, you are going in to observe by yourself. Okay, pick up things that the patient couldn't actually tell you. So what are the general principles? First of all, you keep the child and you observe. Okay, is the child moving on his own, or you actually talk before the child move? You look at the posture, you look at the gait. So sometimes you can tell them to stand up. If it's children that could actually walk, you tell them to walk a little so that I can see how they are walking. Is there signs of pain or signs of imbalance and all of that? So you should know that you should actually gently handle a child, and anytime you are examining organs or structures that are basically two, always look on this side and also look on this other side. So growth awareness, you now look at every other thing that will basically make you know that okay, this child is actually growing according to the stage which they actually are. So steps now, first of all, you started with history taking. So you take the brief history of the disease condition, you look at all those developmental milestones, okay, when the child actually reached some specific one or two roles, okay, and you are comparing with how a child of that particular stage should actually reach those roles. Family history, this is when you're now trying to look at if there's any history of some disease conditions running within that family line. Then past illnesses, general inspection, you now will look at their posture, look at the skin, if you are seeing any other skin conditions. You allow them to walk a little, so you're trying to actually look at if there's any walking pattern. So symmetry, this way you're not trying to comparing two sides, to actually make sure that they're actually equal. This way you're not trying to measure all those head size and the rest of it. So you examine the head and neck to see if there's any issue. Examine the spine to also see if there's any issue. Okay. Then upper limbs, you're now looking at how far they could actually move a particular joint. Congenital issues. In the lower limb too, you're also looking at all those issues that could come in, how far they could move their leg and the rest of it. You're trying to pinpoint all those dysplasia, knock knees, bow legs, flat foot and the rest of it. Then you can now do your specific test, okay, and this test now is depending on what you're actually suspecting as a medical doctor. So you're now going for specific things depending on what you're actually suspecting that the child has.